Hi, Dr. Tucker here, and today we're going to discuss what do chiropractors do and why do we do what we do. So there's a lot of misconceptions about this. I think namely most people think if you've got neck pain, back pain, headaches, you're going to a chiropractor. Question is, what do we do besides work with it by hand, maybe like a popping technique? So really it comes down to one main system, and that's your nervous system. So essentially, all of the nerves in our spine exit and control different tissues. So it could be your eyes, your head, your heart, your stomach. Everything has nerve supply. So if there's joint dysfunction, some sort of degenerative issue, structural issue that's just subtle like misalignments, these things are not going to be caught on blood work, right? They're essentially something physical in nature, not chemical. So when we find these disruptive signals, because the central nervous system, your brain and spinal cord are located in your spine, we can detect this by actually examining the spine itself. Is there sensitivity at one segment but not the adjacent segment? Is there spasm at one level, not the other level? Is there some sort of restriction in movement? So as a chiropractor, we can detect these irritations to the spine and nervous system and ultimately treat it manually without having to use drugs or surgery. And most of the time, the body can regenerate. It can respond well by taking off pressure on these nerves and letting the nervous system regenerate on its own. So the chiropractor himself should be looking to find areas of spinal dysfunction and try to relieve nerve pressure so the body can regenerate on its own. And in turn, you'll see symptoms go away. It could be an organ issue. It could be headaches. It might be back pain. It might be sciatica. And this is why it's worth screening the spine and nervous system, because not too many people are really examining for this.